And so when we look at the global number of infants vaccinated against measles, we're seeing an interesting trend. The total number of 1-year-olds being here, this is from our world data. And then you see those vaccinated against measles, and you see that something happened somewhere around the late 1990s that kind of dropped that number. And then you can see that in the late 2017, 2018, you can see that number drop again. So what is accounting for that drop that we see in the late 1990s? That came from a paper published in The Lancet by Andrew Wakefield, where if you look at the title, you would never think this had anything to do with measles. The paper was later retracted, but way too long. In fact, the biggest mistake made with this paper was that it ever got past reviewers and got published, because it was really a poorly written paper, and what passed for a study was really measly. Eventually, most of the authors took their names off, as most of the co-authors took their names off. And you can see here, this study had more authors than it had patients in the study. But Andrew Wakefield, a physician in the UK, well-spoken, very charismatic, published this paper. And essentially what the paper claimed was that vaccination with the MMR vaccine, vaccine of choice for measles, mumps, and rubella, led to kids having autism. And this study had 12 children. It had no control group. So he failed to have a control group with children who were unvaccinated in there. And in the UK, vaccination rate for measles was above 90%. So the vast majority of kids got the MMR vaccine anyway. And autism symptoms, as we know, typically emerge right around the same time that you actually have the measles vaccine. And then it became clear later that Andrew Wakefield actually lied outright in this publication, where he suggested that the biopsy tissues and the gastrointestinal issues that the kids were having, the biopsies that he took, suggested that they had these after they'd gotten the measles shot. But it turns out that data showed that a lot of these kids had autism symptoms before they ever got the MMR vaccine. And when one look at the claim that he's making from this, that the MMR vaccine at the time, he said that it was the combination, that you needed to separate the vaccines. He didn't reveal that was advising a competing company and getting compensated for it to have an alternative to the MMR vaccine. Never revealed that. But essentially what he had was a really tiny group of children, many of whom he recruited at one of his kids' birthday parties from the literature. And this group of 12 children could not give you what we call in statistics the power, the statistical power to make any sweeping conclusions from it. However, with all the issues with this study, this thing caught on like wildfire. The Lancet published that paper. It went all throughout the country, went abroad in the United States here. Many people picked it up. Andrew Wakefield, after losing his license in the UK, literally took up residence here in the United States, where he found many supporters of this myth that the MMR vaccine was linked to autism. Now, in the aftermath of that, many other studies found that there was no link. His study was published in 1998. Almost immediately, a study came out in 1999 looking at 500 children, way more than he ever looked at, finding no link. Then there was another study in 2001 with 10,000 children. Then the Danish study with over 500,000 children. Then there was another study from Finland with another 500,000 children. Then there was another study in 2004 refuting these claims, showing that he falsified data. And so essentially, there were studies after studies after studies that showed that there was no link between the MMR vaccine and autism. But look at the data from the UK. You can see vaccination rate above 90%, right around 91%. Started dropping a little bit before Wakefield's paper. And then it plummeted for many, many years after. And so measles cases went up significantly. It was a similar trend in the US, where MMR vaccine uptake plummeted after that paper came out, dropping precipitously before we started seeing a rise again. So the effect of this misinformation and disinformation based on Dr. Schachtner's presentation really resonated with people. And When you look at study after study, the Wakefield study in 1998, he actually came and followed up in 2002 with another study that was also retracted. And study after study refuted the MMR autism link, but it didn't seem to matter much to people. When you look at the studies overall, you can see here in yellow, these are people who are unvaccinated with MMR vaccine, versus the blue, those who are vaccinated. And you look at the rate of autism, you can see that overall, the rate of autism continued to increase, but it actually increased more significantly. Well, it wasn't statistically significant, but it was a higher number in those who were unvaccinated versus those who were vaccinated when you look at the overall numbers. And when you actually look at the risk factors for autism, vaccine is not in there. So we know that smoking is a risk factor for autism. We know that premature birth is a factor. We know that older paternal age, above 40 years old, significantly increases the risk of having an autistic child. Same thing for the mother, age over 35. And when you actually look at the data carefully, like in the United States here, you'll see that autism spectrum disorders are linked to gender. Male children are way more likely to have autism spectrum disorder. And even by state, if you live in Alabama, you're way less likely to have an autistic child than if you live in New Jersey. And the question is, why are these things happening? Is there some environmental factor that's going on? These studies have not reached the level that they could have because of the distraction of having to prove and disprove this autism MMR vaccine link. And so here I've listed the major studies that have been published over the years, including a 2019 study that had over 600,000 participants from Denmark. It turns out that millions of people have been tested to disprove this study that had 12 children, and we still can't seem to get a handle on it. But what is the reality? The reality is that measles vaccine actually saved lives. It's estimated that 94 million lives have been saved since 1974 by the measles vaccine globally.